Fluid on the lungs, also known as pulmonary edema, and chest infection, which encompasses a range of respiratory infections, are two conditions that can significantly impact breathing and overall health. Symptoms of pulmonary edema may include shortness of breath, especially when lying down, a feeling of suffocation or drowning, wheezing, or a cough that produces frothy sputum that may be tinged with blood. On the other hand, common indicators of a chest infection can be persistent cough, production of mucus, sputum, chest pain, and fever, along with difficulty breathing. Treatment for these conditions varies. Pulmonary edema may require emergency treatment to remove the fluid and support oxygen levels, while chest infections may be treated with antibiotics, antivirals, or supportive care like hydration and rest. Risk factors for developing pulmonary edema include heart conditions, high-altitude exposure, or damage to the lung tissue, while chest infections are more likely if one has a weakened immune system, smokes tobacco, or has a chronic lung disease. Here's a detailed look at the nuanced aspects of fluid on the lungs and chest infections, diving into causes, prevention, and management strategies for these serious health challenges. Type of condition: accumulation versus infectious. When assessing a patient with respiratory symptoms, distinguishing between fluid on the lungs, pulmonary edema, and a chest infection, pneumonia, is critical as each condition requires a different treatment approach. Pulmonary edema, an accumulation condition, is usually due to heart problems or changes in blood vessel permeability, leading to fluid leakage into lung tissue. In contrast, pneumonia is an infectious process caused by bacteria, viruses, or fungi, inciting an inflammatory response. Clinically, pulmonary edema presents with rapid breathing, pink frothy sputum, and often a history of cardiac issues, whereas pneumonia typically manifests with fever, productive cough, and localized pain. Chest X-rays, blood tests, and auscultation help differentiate the two, guiding effective intervention, whether diuretics and oxygen for edema or antibiotics and supportive care for infection. Primary symptom presentation: wet lungs, effusion, versus systemic symptoms, fever, cough. Fluid on the lungs, also known as a pleural effusion, manifests often with shortness of breath, chest pain, and sometimes a dry cough, with symptoms usually related to the volume of fluid and the rate at which it accumulates. The effusion itself is a symptom rather than a disease and can be caused by various conditions, including heart failure, infection, or malignancies. On the other hand, a chest infection, such as pneumonia, will typically present with systemic symptoms, including high fever, productive cough with phlegm, and possible chest discomfort with breathing. Listening to the chest, clinicians might hear rales or crackles in pneumonia, while decreased breath sounds may be more characteristic of a large pleural effusion. Diagnosis often entails imaging like a chest X-ray or CT, which can differentiate between these conditions by visualizing fluid levels or infiltrates indicative of infection. Underlying causes: non-infectious origins, heart failure, kidney disease versus microbial invasion, bacteria, viruses. Fluid accumulation in the lungs, medically known as pulmonary edema, often manifests when the heart cannot pump effectively, leading to congestive heart failure, where blood backlogs into the pulmonary circulation. This condition is not infectious, but can result in symptoms mimicking a chest infection, such as breathlessness and reduced oxygenation. Conversely, chest infections are primarily caused by pathogens like bacteria or viruses that invade lung tissue, prompting an immune response. Symptoms can overlap with fluid-related lung issues, but these infections generally respond to antimicrobials, whereas heart or kidney failure-associated fluid retention necessitates addressing the underlying non-infectious condition, often through diuretics and supportive therapies. Distinguishing between these causatives is crucial for effective treatment. Treatment approach: removal of fluid versus antibiotics, antivirals. When clinicians confront fluid in the lungs or a chest infection, treatment strategies differ significantly. Fluid accumulation, known as pleural effusion, often requires drainage to alleviate symptoms and prevent complications. This is typically performed through thoracentesis, where a needle extracts the fluid. Conversely, chest infections caused by bacterial or viral pathogens demand a tailored approach. Antibiotics are prescribed for bacterial infections, whereas antivirals target viruses like influenza. It's crucial that the exact cause is identified, as misapplication of antibiotics or antivirals can lead to ineffective treatment and contribute to resistance. Often, these conditions coexist, necessitating a multifaceted treatment protocol to address both the infection and the resultant fluid buildup. Prognosis considerations: chronic management versus potential for acute resolution, fluid on the lungs or pleural effusion, and chest infections like pneumonia can present similarly with symptoms like cough and shortness of breath, but their prognosis and management differ greatly. Pleural effusion may be caused by chronic conditions such as heart failure or cirrhosis, often requiring long-term treatment to manage the underlying ailment. In contrast, chest infections can typically be acute, with a potential for complete resolution through antibiotics or antiviral medications, although severe cases may lead to chronic complications. Accurate diagnosis is thus critical to determine whether a patient faces a potentially chronic management journey or a condition with a favorable, acute prognosis with appropriate and timely treatment.